we're live now.
Okay.
We have to get everybody on video, right?
So just a few, we're going to wait just 2 more minutes, but just a few housekeeping rules for everybody, because we are going to put up slides. If you could, everybody's muted at this point in time because we want to respect people being able to hear the message. We want everyone to use the chat button to put in your questions. We do have all the questions that you sent out via the link ahead of time, so that we'll be answering all those questions hopefully today, and then new questions that come up, we will try to answer them real time. But if you can click off your video, click on your button that says stop video, that way it's, because there's gonna be a lot of video if everybody puts their video up, and we will be having slides. So just a few housekeeping items there. We also want everyone to know that this is being recorded, so that we can play this for, offer a link for those that weren't able to participate. But for everyone, the chat button is at the bottom, and you can just type in your questions and we'll try to respond as soon as we can. So we're just gonna wait. Contact Jamie McGowan, text her if you have any trouble getting to the Zoom meeting, or if you're having issues. Hold on one second.
Admit all at the top again.
All right, let me admit all again. Hold on, tell me if that's okay. Okay, 7 people are waiting. Here, let me admit all. 2 people waiting. It looks like everyone's admitted at this point. Wait a minute.
As people join,
Yeah.
interesting. That's weird.
All right, I'm letting everybody in.
Maybe because
Okay. So as soon, if we see people come on, just let me know, Suzanne. I'll hit the admit button again. So it is 4:02, Bernadette. What time is it?
4:02.
Okay, 4:02. So once again, let me repeat the housekeeping items here before we start. Text Jamie McGowan if you're unable to get into the meeting and you have any questions. She will help you. This is being recorded so that we can share this link with those that are unable to attend. We do have you muted so that we're able to get through the presentation and answer all your questions via chat. Otherwise, it just gets too noisy and the background noise. So we want everybody to be able to hear us clearly. So thank you for that. Appreciate it. And I think that's a couple more people to admit. Okay. So I think that's the housekeeping rules. And if you could turn your video off, that way it's, because it's distracting, we are gonna have, just put stop video. We're gonna have some presentation slides and so on. So we're still admitting people, excuse me for that. I'll continue to watch that. All right, so let's start. Okay, so
just before you start, I'm just going to ask you to maybe just to look at the chat and to see if there's anything else in the chat. But just in case
let me see in the chat. Let's see if anyone's asking anything. You are on live for iPad users. Go to the top right, click on the 3 dots, and you will see the stop video in chat. If you have any technical issues on the iPad, please tiger text Jamie. Everybody got it. Okay, it looks like, so let's start. Okay.
Okay, I think that's
Ready? Okay.
right.
So it's here. We are in the midst of a pandemic crisis that is disrupting global markets, businesses, and every sector of our lives. And we are promised it will do much more damage over an indeterminate amount of time. Life as we have known it has changed. My hope for you, your families, and all of your patients is that you remain safe and healthy. With this, I want you all to know you are in my morning and evening prayers daily. The purpose of this meeting today is to answer all your questions and provide clarity. And yes, you deserve, as employees, to know what is NVNA and Hospice doing to protect patients, staff, and the business viability. Every day, I am grateful for the teamwork and resilience of our staff. So thank you to everyone for your commitment. Most importantly, to those who are caring for our patients, the nurses, home health aides, therapists, social workers, nurse practitioners, and physicians. This weekend, I had to call a nurse to tell her she was exposed to COVID-19 by a patient she saw. She responded that she only felt sorry for not being able to see her patients on Monday. She said nothing about her own health. This selflessness is what we are seeing every day with our healthcare workers. So much is not in our control. It is challenging to determine what assistance is available to our agency. Supplies and revenue are all running short, yet a fundamental rule of crisis management is to exercise as much control as possible over events as they unfold, using every tool available to us to bring about a positive outcome. In fact, how we respond to the COVID-19 crisis says more about who we are than it does about the crisis itself. The incident command team went into action 4 weeks ago. Yes, it's been just 4 weeks, believe it or not, and continue to provide up-to-date information to our staff following the DPH and CDC guidelines. I know these updates change daily as the disease morphs. We are getting daily guidance from the experts as well. Now that the current coronavirus is officially a pandemic, we surely need to develop ever more advanced thinking on how to deal with it. As you are witnessing, our referrals are down by 66%, and this will not improve until the surgeons are back in the operating room. Optimistically, we hope to see a very busy June, July, August, and September. Michael Rogers and the development team continue to raise money despite this interruption. Everyone's been very generous. We need this financial support now more than ever. I know you have many questions about the paid sick leave. Kristen Chapin's going to go into that in detail for you. But I just want you to know our goal is to retain staff and apply for all the relief that is available to support our business continuation. Kathleen Powers and the finance team have applied for all the relief that's available with the payroll protection plan. I think we were the first submission to Rockland Trust, and we have stayed on top of that, and they are processing that for us right now. Many of my sister agencies, and as you read, many of the healthcare agencies have furloughed their workers. Our goal, as I said, is to retain staff and apply for relief. So more to come on that. As a hallmark of NVNA, we are remaining flexible. An example of this flexibility is the work Noreen Cataldo's team, the liaisons are doing to increase referrals. They're calling our patients 30 to 60 days post-discharge and calling case managers at our referring hospitals to remind them we are here to take their patients. They're also calling our referring physicians to remind them we can support them with telehealth visits and face-to-face encounters. And they're very excited about this opportunity. We need to remain focused, quell obsessive rumination or panic, and turn towards positive action. Luckily, in the current pandemic, there are lots of precautions to take and communications to make. I promise you this, I will remain calm, address your questions, fears, and concerns as new information becomes available. Almost every crisis of a certain magnitude calls for a war room. In this case, we have a virtual one. Our incident command team is congregating, planning, and meticulously organizing our crisis response. We're having Zoom meetings daily, and our top priorities on every call are patient and staff safety first, business viability, and staff retention. But kindness must rule. We must all be so vigilant against rumors and gossip. We hope to answer all of your questions here today. This is real, and the onus on each of us is to insist upon integrity. Beyond today, please know we're committed to being transparent as possible about this pandemic and how it will impact NVNA and Hospice. Your questions and concerns will not go unanswered. Please know I'm here every day. My door is open. You have to stay 6 feet away with your mask on. Those are the rules of the office, but happy to see you, meet with you, call me, email me. Please know I am here to answer any of your questions. So with that, I'm going to ask Kristen Chapin to first step up and talk about paid sick leave, unemployment, quarantine, and all those questions you've already sent in to us prior to this meeting. Thank you so much. Kevin.
Hi, everybody.
Are you seeing her?
You see me? Okay. Hi, everyone. Thank you so much for joining us today. As you know, we asked you to submit questions in advance, and we've all taken a look at those questions. So I'm hoping that the answers to the questions that you've asked are going to be included in what I have to say. And then, of course, we're going to leave time at the end of this to cover any additional questions that you have. So one of the big themes that came through in your questions is, are we planning to furlough or lay off employees? As a leadership team here at NVNA, we have agreed that our top priority is to try not to do this. Of course, the situation is fluid, and we don't know what the future is going to hold. But we are leaving no stone unturned in our search for programs that provide relief to small businesses and to the healthcare industry. Kathleen Powers and her team has been hugely helpful in getting us going with those applications. This includes a very thorough review of all of our finances, of the cash flow, and we've applied to multiple different relief programs, which incentivize us to retain our staff. So that is the goal that we're trying to stick to. We're trying very hard not to have to follow in the footsteps of many of our sister agencies who have had to furlough their staff rather than apply for relief programs. To be transparent, due to the drop in our census, we have seen a decline in hours available to our per diem colleagues. We hope that we'll be able to bring them back to work as soon as we have hours available to them. Many of you have asked about the Family First legislation, which was designed to provide paid leave. As a healthcare organization and as a group of essential workers, we are exempt from this Family First legislation issued by the Department of Labor. So why are we exempt? Why, as healthcare workers, are we exempt? Why has NVNA chosen to stick with the exemptions? There's two main reasons for this. One, the allowance under the legislation has the potential to reduce our workforce to such a degree that we would not be able to maintain continuity of operations, which means that we might not have the workforce to care for our patients. This situation could start a spiral, which then leads to an even bigger drop in census, which leads to a bigger drop in revenue, which means we would then have no choice but to pursue a layoff or furlough situation. And so we're really working hard to do everything we can to prevent that from happening. And recovery at that point would be very difficult for us as a business and as an agency. And so at this point in time, the answer is we simply just can't afford to provide that leave and continue to preserve jobs. The math just isn't there. We've chosen to preserve the jobs as our #1 priority. So you've asked a lot of questions about quarantine and if you're ill, and if you would have to use earned time as a result of that. So right now the answer to that is yes. I am not going to try to even sugarcoat that for you because I know it's a source of great disappointment for a lot of people. I'm disappointed in having to say it, but for now the answer is yes. However, we have learned that during this crisis, the unemployment rules have hugely been relaxed in this situation, so that if you are sick because of COVID or if you have to quarantine because of COVID, you are now eligible to file for unemployment, even though you are technically not unemployed. You would just have a gap in your time that you'd be able to work. And the relief programs around unemployment are designed to help you in that gap. Each person would have to weigh the pros and cons of that program, and each person's situation is unique. So I can't give blanket advice as to whether everybody should universally do that or not do it. Everybody's situation is unique, and there's many factors to consider, such as taxes, such as insurance premiums that would have to continue to be paid if you were on our benefits plans. The state is trying to keep up with the volume of applicants, although they've relaxed some of the back of the house administrative things that Sharon and I would have to work on in the hopes of getting unemployment money flowing as quickly as possible if you do find yourself in that situation, that if you want to apply for that. for a furlough situation or an illness. They're trying to get that money flowing quickly and trying not to make the employers be the hang up on that. So some relaxation there on those rules. Sharon and I are available to help with this if you find yourself in this situation, if you want to talk privately, if you have questions about what this is or what it might mean to you, please feel free to reach out to me or to Sharon, and we can have a conversation or a Zoom chat and kind of walk through all of your available options. So please don't hesitate. Don't be shy to reach out. It's complicated and it's confusing, and we're all learning it together, and we're happy to walk you through that. So we're going to leave time to cover questions at the end, but for right now, I'll turn it over to Suzanne.
Good afternoon, everyone. I'd like to answer your questions about the guidance that we've been providing the agency during this state of emergency. Our sources for all guidance are the Massachusetts Department of Public Health and the CDC. We have an infection control and prevention team at our agency that includes Andrea Foley, Trish Kelleher, and myself. Andrea is our infection control and prevention nurse specialist, and she has worked on all of our infection control and prevention policies, including our pandemic influenza policy. Trish Kelleher is the Board of Health nurse for Norwell, Whitman, and Hanson. She tracks all the cases in her towns and receives frequent guidance and updates from the Mass Department of Public Health. This team has closely monitored all updates to guidance from the DPH and CDC, which includes online information and weekly conference calls. We also have access to the State Department of Public Health epidemiology phone line. We have contacted the EPI line multiple times to ensure that we are correctly understanding and following the published guidance, since most of the guidance is directed to hospitals and healthcare facilities, not to home care and hospice. When Governor Baker called the state of emergency on March 10th, the only guidance specifically for home care and hospice was in the original Massachusetts Department of Public Health agency-based in-home caregiver employee and patient screening flowchart, which I'm going to try to pull up on the screen right now. So I'm going to be sharing my screen, and first I need to admit somebody. And then I'm going to share my screen here. Let's see. Excellent, it worked. Hopefully you can all see that. Let me just move this here. Great. Okay, let me make it a little bit bigger. All right, so this is the original flow sheet that we released on March 13th. It provided guidance in two directions. One was the questions that we had everyone asking or answering to their manager. So every employee was, and still is, using these questions. And then if they are answering yes, then they should not be coming to work. That was the way that this flow chart was working. And then the other side of the flow chart was the questions that we are asking all of our patients, and that directed us to the type of PPE that we were going to be using with that patient. So this is the original one. So in this original one, you'll notice that we don't have any PPE that was assigned back when we first came out with this, which was guided to us on March 13th. So we had no PPE for routine visits. This was basically droplet precaution, and then this was airborne precautions with very minor amounts of guidance right here. So this chart is still available if you want to look for it on the Massachusetts Department of Public Health website. It has not been updated, but we, as our team, worked together and looked at the CDC and DPH guidance, has decided to update this flow chart. We updated it 7 times. You probably know that because it came out multiple times in emails to you and on Mass 360. And why? Why did we do that? Because we're updating it to DPH and CDC guidance. And that has changed as more and more was being learned about COVID-19 and its transmission. And we also wanted to make this guidance a little easier to follow. So what we ended up doing was we separated these into 2 different guidance. So we had a employee guidance, which let me make it a little bigger for you. So this is our current employee screening flow sheet, and then we have a separate one that's a patient screening flow sheet. So we'll go through we're going to go through this briefly, but I do want to say that for the clinicians, we are going to be going through this more specifically next week in our education presentations. Right? So this is the employee. So the employee is answering these questions every morning to their manager. If they answer no, then they can come to work. Sometimes we get a no, but I know somebody else who's been exposed kind of questions. So that's guided as well. The manager has guidance to that. If the clinician says yes to any of the questions, so question 1, 2, 3, and 4, we have guidance in all of those areas on what needs to happen, from contacting doctors to 14-day quarantines to determining exposure level. And so this is the risk level. If somebody did have some type of close contact with somebody, a patient or a person that was diagnosed with COVID, then they would be kind of put into 2 different risk areas, low, well, 3, low, high, or medium risk areas. And that goes to the second page of this tool. This tool is, has gone out in Bernadette's email and is on Mass 360 and is in the supervisor resource on the S drive. So this is a tool that the managers are using to determine what type of exposure, what was the potential, the risk assessment for the potential exposure. And when you look at this, it breaks it up into 2 different sections. This top section is for prolonged contact with a COVID-19 patient who was wearing a face mask. And the bottom part is contact with a COVID-19 patient who was not wearing a face mask. And then these columns are whether or not the healthcare provider was wearing PPE and what type of PPE. So that's the same going down to the lower part as well. And then you'll see this second column here is exposure category. So this is medium, low, or high risk exposure category. And then what do we do about that? So do we just have the person monitor themselves and they're not out of work, or are we recommending an exclusion of work for 14 days after the exposure? Down below this, there is a lot more information that the managers are using to make these decisions. And then there's a 14-day quarantine calculator. And then there's a return to work criteria for any of our healthcare providers that have been confirmed or suspected to have COVID-19, and that's on here as well. So this is, again, this is a quick overview on this one here. Going to move over to the patient flow chart. Why can't I make this a little bit bigger? Let me see if I can make it a little bit bigger. Can't seem to get at my controls. Bear with me a little bit. I just got to make this a little bit bigger, my control. There we go. Yay, and I did it. Okay, so this is the patient screening flow chart. This is the flow chart that every clinician is using prior to going out. So they are asking the patient or the representative every visit if they or anyone who lives in the house answers yes to any of these questions. They're also assessing that as upon entering the home at every visit, because we know things can be different when we arrive. And then depending on what those questions are answered, we have significant guidance as to which types of PPE need to be used. If they answer no, or they have an exposure but no symptoms, they come into this, what we're calling the green box, which is the crisis standard precautions PPE. So if you remember on the first, on March 13th, there was no PPE in this area. What we have determined with more and more information learned about COVID-19, particularly the asymptomatic transmission that can happen prior to, that we might be seeing a patient before they have symptoms, we wanted to make sure that we were protecting our staff. So we have face masks, reusable goggles. We do know there's issues with the goggles, and we are trying to work through that, and I think Bernadette may be talking a little bit about that when she comes up. And then gloves for all the patient contacts. The reuse of the face masks and the goggles, if you go down below that, you'll see that policy and procedure on how to reuse those. If the patient does have symptoms, then they land in the yellow box, which is at least droplet precautions, but it is up to or the clinicians to contact the doctor, work with the doctor to determine whether or not droplet precautions are appropriate in this case, or whether or not the patient should be moved to airborne precautions, because if that person has symptoms, they may be needing to be tested if they are being tested there in the airborne precautions. And so please, please really read these, and we will go through them more clinically next week, but there's important information in these boxes for you to use. So the fact that we made this change here with the goggles really protects you in that previous, in the employee screening, and puts our people more in the low exposure category so that they're not being excluded from work. So that was really made in response to the changing guidance, and it significantly impacts the number of people that would need to be put under quarantine. So these flow charts are important for you to use to help you to make decisions, but we do want you to know that you do not need to make these decisions alone. You know, we have a support team right here. Your manager is here to support you. We have the state epi line we call all the time. And we are all here working together, trying to make these decisions together. So please call with any questions or concerns you have, and even just to confirm your decision. We do have N95 masks. The masks come in various sizes. We have fit tested 37 people as of today, and 31 of them are nurses. And we will continue to fit test as needed as we see how many patients we have coming onto our our service. And just there's so many factors that go into fit testing. As with most healthcare providers, we are trying to watch our inventory very closely. The fit testing process itself can be a source of wasted masks, and we need to make sure that we have enough masks so our clinicians who are providing care to our COVID positive patients are safe. You will never be sent out to see a COVID patient without the correct PPE. However, clinicians may be in a home where they discover through their assessment that the patient or someone else in the home has COVID or is being tested. We have asked all clinicians to screen all patients prior to every visit using the patient screening flowchart to prevent this from happening. We are also increased the level of PPE used for all patient encounters to include goggles, face masks, and gloves. This new level of PPE significantly decreases the level of exposure to a low risk. At any time a clinician feels unsafe in a home, they should leave the home and contact their manager. That has always been our policy, that we should be doing that. I'm thinking I might need to, I don't want to new share. How do I get out of?
No, that's right. You can just go to more and add those people.
Okay. Then we are also working, do you want to see what this is? I'm not sure whether or not we're being, I'm trying to look at it. Chat, what's going on? I'm sorry if you seeing me and not knowing what I'm doing, but I'm just trying to figure out how to get out of this screen sharing.
See waiting room, maybe? Just go to see waiting room.
First?
Oh, there you go. The people in the waiting room.
Okay, sorry, there's some people that are in the waiting room that I'm going to admit. Okay, I apologize. So again, we are working to streamline our PPE distribution, and we are keeping close track of all of our PPE and supplies. We are determining the daily uses, and we'll ask the state for more if we get to less than 7 days. We're also working with our vendor Medline and other vendors and taking donations to continue to ensure we have the PPE needed to keep our clinicians and our staff safe. We will continue to make changes to the guidance as CDC and DPH change their guidance. Again, we're going to be doing more education next week, but that will include a more specific walkthrough of the flow charts. Please make sure you attend one of those sessions. It will be focused to clinicians. Please also continue to read Bernadette's end of the day emails and look at Mass 360 and supervisor resources for the most up-to-date information. And please continue to put your questions into the chat box. What we will do is try to answer these at the end of the session so that we can do our presentations first. So I'm going to just turn the mic over to
Kristen's going to answer a question.
Kristen, okay, Kristen's going to be answering just a few questions.
I'm back, everybody. Hi. So we had a couple questions come in around earn time. Somebody's question is, you know, how can we be told to use earn time for something outside of our control? I get it. This is outside of all of our control. And right now, I don't have a great answer for that. We are looking at some options, such as allowing people to go into the negative on earn time. But I can't speak definitively to that today. That's something we'll probably have an update on next week as we run some financial models on what that would look like. So please sit tight on that and stay tuned for more updates, but we are looking for that, looking into that as an option for people. And again, the unemployment coverage does not require you to deplete your earn time bank. So if you had to be out because you were ill, or if you had to be out because you were quarantined, you would be eligible for the unemployment. So if anybody finds themselves in that situation, please get in touch with me or get in touch with Sharon, and we can walk you through what that process would look like. And then the second question, would exposure known to be at work fall under workman's comp? The answer to that is maybe. We would file an unemployment, a workers' comp claim for that. But the workers' comp company the insurance agency does their own investigation. And so they have told me that they try to focus on the contact tracing. They're going to want a report from the employee. They're going to want information from us. So I can only offer ideally, yes, you might be entitled to some coverage, but every situation is going to be unique. And again, Sharon and I would certainly work with you to get that information into the insurance company. We will work with the insurance company to provide any benefit that you might be eligible for. So that's going to be a unique situation that we just have to take case by case. But again, please get in touch with Sharon or myself if you find yourself in that situation. And Bernadette is up next.
Hello, everybody. Thank you so much for joining us. So I'm going to go over some of the things we're doing from an operations standpoint to try to get through this. So some of the daily strategies we are using in operations to keep staff safe, patients safe, and business continuity include the following. We are decreasing visits to essential visits only with all disciplines to decrease days in the field and preserve PPE. Thank you all for working so hard at this. We have made huge gains in this, and it has been very helpful to conserve our supplies. It is also very important to use a critical eye to assess what other disciplines truly need to be in on all cases and their frequency. Please look at who is seeing your patient on any given day, and if there are multiple disciplines, please communicate with each other and determine what the patient truly needs. At this time, we need to be performing crisis care, doing the right thing for our patients while keeping in mind the true needs of the patients. We have increased access to telemed, FaceTime, and wellness calls to continue to support our patients at home and keep them out of the hospital while preserving PPE and allow for virtual case management. We know, I have new data since I wrote this. In March, HRS video calls were up to 251 from 64 in February. So that's excellent. These are just the HRS ones. This doesn't include wellness calls or FaceTime visits, but at least we see such huge improvements in the HRS utilization. It's promising to know that you guys are still making connections with your patients through virtual videos. The videos watched are up. They doubled. So in February, the videos watched by the patients were 11, and they're up to 25. So that's great. We're utilizing technology to support and educate our patients. This has allowed continued contact with our patients and has proven very successful. The more contacts with the patients, that aids in their anxiety and ensures their confidence in us as healthcare providers. As Suzanne has said, we are following all CDC and Mass DPH guidelines at all times to ensure safety for all. And we have multiple times utilized the Mass Department of Public Health EpiLine They're very helpful and quick response. They are all epidemiologists and give us great guidance, basically the exact same guidance that we're already using, but it's nice to confirm with somebody of an expert that we're making the right decisions. I encourage you to contact your manager if there are any concerns. They can certainly support you by calling the epi line and walking you through the flow chart. Things change, and you may find things are different when you see the patient, and you are encouraged to use your clinical judgment and call your manager with any concerns. We trust your judgment, and we want to support you and your clinical decisions. We do not want anyone in an unsafe situation. This is the same philosophy we have followed prior to this pandemic and will continue to follow forever. We have limited visitation at the Pat Roach Hospice House to 1 visitor at a time per resident. All visitors are wearing masks, and the staff are following the same guidelines as our field staff. We have most recently put into place that all referrals to the hospice house from a healthcare facility will be required to quarantine for 14 days after discharge from that facility prior to it being admitted to our hospice house. Given our census is significantly lower than expected, we have creatively repurposed many staff to support PPE management with counting, bagging, and distributing PPE, as well as in other ways to support operations. The supplies need to be tightly managed and preserved, so we appreciate everyone's support in answering the surveys and attending the designated distribution times. Yesterday, I submitted a request to the state for specific items and quantities. I'm waiting to hear back from them. We have heard your feedback about the goggles fogging up, and we have ordered some anti-fog wipes just today. They should be here in 1 to 2 business days, and we will get them out to you as soon as possible. The managers are working with staff that are on quarantine, understanding this is a challenging time for them. They are encouraged to work on e-learning, virtual case management, and remote work when available. Education opportunities have included Nicole DePace's presentation, which are also recorded for future viewing. Nicole is working on education for next week and ongoing as well. The education team has increased e-learning assignments and looking at online learning opportunities. Please work with your manager if you have the time and interest in increasing virtual learning opportunities. Internally, the intake team is screening all patients prior to acceptance and following the process. There's a very strict process that Megan Groves has written, and they are following that to gather the information we needed, including dates of testing and results, what precautions the hospital has recommended, and will confirm whether patients are on COVID floors or non-COVID floors, amongst many other things. If the intake team is not able to help obtain, to obtain this adequate information, we are reaching out to our liaisons, and they are calling the floors, calling the facilities, and getting the information that we need. This is something we are tracking daily. Megan Groves and I review all COVID positive patients or presumptive patients prior to accepting them. If you are told you are going to be seeing a COVID positive or presumed patient and that you will be required to follow airborne precautions, your manager will arrange for you to be fit tested with an N95 mask if you haven't been already. We are looking at who has been fit tested and who is available at that time or that day to see the patient. We are closely monitoring workforce management, taking into consideration staff that do not meet the criteria to work with COVID patients. You will never be sent into a home without the proper PPE, including an N95 mask, if the patient is on airborne precautions. So walking through the steps, your manager will contact you if you are scheduled to see a patient on airborne precautions. You will be fit tested and provided with an N95 mask if you have not been already. You will come to the office and meet with your manager, pick up PPE, equipment, and telemed equipment that is appropriate and as needed. You will be given a checklist to follow during your visit and reminders of sequence of doff and don of PPE, as well as handouts for the patient that include 10 ways to manage respiratory symptoms and steps to prevent spread of COVID-19. Jamie has put all that together, and it will be ready. It'll be given out as needed to staff as they enter into a COVID positive home. At this point, we have a total of 6 active patients on caseload who are on airborne precautions and 13 on droplet precautions throughout the agency's census. We currently have 5 staff under quarantine. This includes a COVID positive works employee, 2 are quarantined due to personal exposures, and 3 are quarantined due to medium-level exposure to an agency patient. We have no home care or hospice employees who have tested positive. Only one works employee has tested positive. Please know you will be notified directly, verbally, by your manager or designated manager if we become aware that you have been exposed. The manager will work on contact tracking and determine who else may be involved on that case. We are following strictly the CDC guidelines to determine the level of exposure, high, medium, or low. Suzanne went through the flow charts. You can see how we work through that with the information that we have to determine the next steps. As Suzanne has said, we have not had anyone fall in the high exposure category. Thank you again for all you are doing. This is not an easy time, and we appreciate how hard you are all working. As always, please reach out to your manager or myself if you have any questions or concerns. I think I'm turning it back to Renee.
Thank you. Just to answer a few more questions that just popped up is, can we eliminate the cap on our earned time in case we do not need to be, in case we need to be quarantined? So the cap is there so that you stop earning time. If you reach your cap, that means you stop earning time. So that shouldn't happen. Maybe what you're asking is, if you run out of earned time, what would happen? And that's what Kristen and I have been talking about. We're looking at our policies and the documents on earned time to see if what we would be able to give to staff for negative, to go into the negative bank. So I hope that answers the question. So you can go, we're looking at how much time we can go into the negative, but yes, that's what we're looking at. The cap is there so that when you reach the cap, you stop accruing time. That's a little bit different. So hopefully I answered that question. If not, ask it again. And I'll try to answer. Oh, also someone asked, are we seeing the census in other agencies such as South Shore VNA drop significantly as well? I can't speak for South Shore VNA. They do have the feeder from the hospital, so their census might not be down as much as ours, but I do know all of my sister agencies that belong to the Home Care Alliance and Fanani are down 50 to 60 to 70%, some of them, in referrals. So it's pretty much across the board. I am sure South Shore VNA is feeling some hit from this as well. So I think that's all the questions. If anybody has any other questions they want to type in quickly, we will answer them. If not, please email your manager or me with any additional questions that you think of after this session, after this town hall. We hope to have more town halls. Give us your feedback on how this went and what other information you would like. We would love your constructive criticism. Thank you. One more question. Okay.
What is the cap on?
The cap on earned time, Kristen, varies.
It depends on, there's a whole equation, depends on how many hours you work, how long
Right.
you're in here.
So the cap on earned time varies depending on, as you know, after you're here so many years, you get more earned time. So that changes over time. So it changes after 10 years, it changes after 20 years. I believe it changes after 3 years. Kristen can absolutely give you that information so you know what your earned time cap is, but it does differ for everybody. So it's different for each individual depending on how many years you've worked here.
And how many hours?
And how many hours you work. So hopefully, I hope that answers your question. Kelly may be asking to define what the cap is. Okay. Any other questions before we, what do we tell assisted livings after we have been exposed to a patient as they, to a cover as they ask us?
Oh, but here, it's clarification. They won't let us in if we've said they've been exposed. So I'm thinking
Right.
that if assisted living asks them if you've been exposed, they won't let us in if we say yes.
Yeah, so the assisted livings, first of all, are really letting no one in. So if you answer yes, that you have been exposed, you need to call your manager, talk with them. You can talk to the assisted living about the personal protective equipment that we're wearing, which prevents spread, because you're not testing positive, you don't have any symptoms. So you're just answering yes to that one question, which says, have you been exposed, but you have no symptoms and you don't have COVID yourself. So the assisted livings are being extremely strict. So I would call your manager, and then you could talk with the wellness coordinator, wellness nurse at the assisted living, and they all might be a little bit different, but you could explain the personal protective equipment we're using now, and how it, the exposure is not as great with that equipment. They may still say no if it's not what they consider a necessary visit.
And probably that they let you back in after 14 days, right?
Yeah, so they'll let you back in after 14 days. Okay, so
We've got another question.
another question.
About Barbary, I think, right here.
Is there a script we should be telling patients when we cancel visits if we are out of work due to being exposed? If you're out of work and you're quarantined due to being exposed, that would be the manager and the other nurse that would be visiting that patient. We don't expect you to call your patients and tell them that you're going to be out for 14 days. What we'd do is we want to protect everybody's, I mean, there is some HIPAA involvement here, so we do want to protect your personal information. What we're doing is just like we would do in the Department of Public Health. When you do tracking for the Department of Public Health, there's a process to follow, how you notify people, and that is allowable to be able to notify people when they have been exposed. But we don't expect you, the person at home on quarantine, to be calling your patients. We will do that. And Bernadette's adding, unless you're virtually case managing. So if you're virtually case managing, I would call your manager and talk with them, and we can develop a better script for you. But you are allowed to protect your own information as well. So you don't need to tell them that. You could tell them you're virtually case managing. So, but we'll talk about maybe putting together a script. Thank you for that question.
Can you just confirm, let them know that caps and bonnets and shoe covers are part of the airborne precautions.
Yeah, Suzanne's going to say one more thing. I have to move 6 feet away.
Yeah, I have to get close to the microphone. Okay, yes, the bonnets and shoe covers are included in the airborne precautions. They are probably not on the flow chart, so I can add those to the flow chart, but they are a part of the kit that you would get as for airborne precautions.
Thank you, Suzanne. Okay, when we return back to work after completing quarantine and a patient's asked why we were out, do we have guidance as to what to say? So I think that totally, you do, I mean, I really don't think you need to say to your patients that you've been out of work due to quarantine. You could just be off, or you could be on vacation, or you could be whatever you want to be. But we can come up with a script for that, but that's really truly confidentiality, right? So it's, I understand what you're saying, because I've been a home care nurse. I understand how close you get to your patients and they become part of your family and you of theirs. But with this COVID, it's alarming to people, and they get nervous because they don't understand what we're doing to protect ourselves and protect them is following the CDC guidelines. So what we're doing is exactly what we need to do, but sometimes that makes people nervous just to hear the story that possibly you were exposed and now you're quarantined, even though you maybe did not have the virus. So I think we just want to keep it more, we will help you though with that. I would call your manager, but we can help you. Kristen, we'll come up with a script. We'll talk about that to help you. Thank you for that question. Those are hard questions. I totally understand how hard that can be.
Answer the next two questions.
And Suzanne's going to answer the next two questions. I'm bringing up Dr. Fauci now.
No, I don't
I'm
think
6
so.
feet away.
I don't think so. Okay, so one of the questions, oh, let me just get where I can see it. Hold on a second. Okay. Do we provide masks for patients if they say yes to the screen, or are they responsible? So we cannot provide masks for all of our patients. If you walk into a patient and they cannot provide a barrier for themselves and they are coughing and you want to provide them a mask, you can give them one of your masks, but we cannot provide masks at this time. However, we are getting a lot of donations of different types of masks, and some of these masks might be appropriate for us to hand out to patients. They would just be not surgical masks, but just barriers. So what we're trying to do is get a barrier around that patient, and so they could be using, the CDC says a tissue as a barrier, but like we're all using different types of masks right now, some type of barrier. So we cannot hand out medical supplies out to our patients at this time. And then Nancy, let's see, what else did you say here? What do we do when enter a house and they have a guest, as this has happened a few times to me? So this is, again, you are screening as you enter the house, just like you're screening when you call, and you're always assessing the situation that you're in. Social distancing, isolation, those are things we need to be teaching our patients depending on the situation that they're in. So it's definitely social distancing. And it is okay for you to let that person know that you are practicing social distancing as well, and that you need to be treating the patient, and they need to maybe move to a different area of the house for social distancing. We do want to assess the environment like we always do and determine whether or not that person, does that guest have COVID? Well, now we've got a patient who is in a situation where they are exposed to somebody who has COVID. So now they're in a different area of the PPE. And at this point, if at any point in time you feel unsafe in a home, you can leave that home. We want to make sure that you feel safe and you have the appropriate PPE. And then, is there a way to enlarge our badges since the patient can't see our faces? That's a good question.
That is a good question. I don't know the answer to that question.
We don't know
right
the answer
now,
to that yet,
but I will research it and find out.
But Kristen will research and see if we can find out. Would you end up with a positive screen ourselves? Our patients would also be notified of their risk. So because you are so PPE'd up, I will say that if you are wearing everything appropriately, that patient is actually at a low risk right now. So, but we are looking at contact tracing, and when we do if you came and you reported that you were exposed or that you were positive with COVID, we would be using the guidance, which is Trish Kelleher. Having her here as a Board of Health nurse is a great resource, so that we would be contact tracing, and possibly the Board of Health in that town would also be contact tracing just at the correct time frame to make sure that anybody who was exposed was notified. I think is there any more questions?
All right.
Thank you, everybody. I think I just want to really on the heels of what Suzanne said, I just want to reiterate to everybody that just so everyone knows, because we did have some questions that came over earlier this week, we are absolutely notifying you if you've had an exposure. So just know that we are verbally notifying you of any exposure. I covered the COVID tracking emails this weekend and worked closely with Megan Weymouth and called people myself. So we are definitely notifying you as soon as possible. If it's a weekend, you're going to be notified. So just know we're protecting you, we're reaching out to you, and I'm not going to, I'll call your home phone. I'll get the information out to you if I need to, if we can't reach you right away. So we'll make sure we get to you as soon as possible. So just know that we're doing that. I think someone said thank you. This is very informative. Oh, yay. That's good. Very positive. Okay. Okay. Is that it, Suzanne? Any more questions come up?
Lynn wants to know.
Do calories count? No. Calories don't count. Actually, there's no calories during COVID time. And we we welcome you to visit us when you pick up your supplies because we have candy, Oreos.
That's what you're getting at.
We have all junk food. Is nothing
Throw them to
healthy.
you.
No calories.
No calories. It's all unhealthy and it's fabulous. So just come in and get your supplies and we'll hand you some junk. There you go. Okay, great.
Oh, yeah. And then, well, you just take it.
Anyone needing help from telemed, just let us know. Okay.
Yeah, so-
All right. So I think, it's almost 5 o'clock and I know everybody wants to go have a nice, happy holiday weekend and I hope everybody gets out. So I just want to end with, once again, I want to thank everyone, every single one of you, particularly all the warriors that are out there, seeing our patients, caring for our patients, putting patients first. We appreciate it, and I hope you know that we truly mean that from our hearts. I also want to thank some warriors here that have been day in and day out tirelessly supporting everybody. So just not to say, I'm not saying thank you to everyone, but a couple of shout outs, Bernadette, Suzanne, Kristen. We probably huddle, well, I know them more now than I've ever known them, huddling daily. And Central Supply, we have a Central Supply now, just like the hospital. Rose, Jamie, Terry McCann. Want to thank Andrea as the infection control nurse. Her guidance has been so important. And Trish Kelleher, as Suzanne said, the Department of Public Health nurse, been so amazing. So I just want to thank all of you warriors out there and be safe. Thank you.
This is how we save it. I want to save things. I'm afraid to.
Call, how do you, for